So right around when I was 30 weeks pregnant, my doctor told me that I was considered high risk because I was over 30, I was carrying twins, and I kept retaining water and the swelling wasn't going down. When the doctor told me that I had preeclampsia, and I delivered within 3 days after being admitted. Madison, who was the smaller of the two, and Dylan weighed 3 pounds, and 3 pounds 7 ounces.
High-Risk Pregnancy Program is a program in the hospital that we have here at Miller Children's that involves the care of women who are pregnant, who have medical and on occasion surgical problems with respect to their pregnancy, or have issues of their pregnancy such as twins or triplets that make them at significant greater risk for experiencing a preterm birth, or could have any constellation of other medical complications that occur as a result of them being sick acutely or chronically, such as patients with diabetes or hypertension or heart disease. It's important to have a program like this at a children's hospital because you have immediate access to an intensive care unit setting so that the mother and the baby are not separated geographically. Frequently what happens in hospitals, and certainly in Southern California, is a woman who has a high-risk pregnancy who gives birth loses contact with their baby because the baby has to be transferred to a different hospital where they have an intensive care unit. That essentially never happens at this facility.
Miller Children's Hospital is unique because under one roof here, we have an obstetric service that can take care of every mother, whether the mother is sick or the babies are sick. We have a neonatal service that is ready and available to take a sick infant and immediately take care of that baby with physicians that are here 24 hours a day, 7 days a week, with technology that is the latest and state of the art. It makes it so that the babies that are born here have the greatest chance of surviving. It's a unique environment because not many hospitals in the state of California, as a matter of fact I don't know of any, that actually have both of these services under one roof. Many families keep in touch long after their babies have graduated from the NICU. Some parents even come back to mentor other parents through the experience.
What was nice was that after I delivered and they made me feel better, they monitored my blood pressure, was that just down the hall, when Dad was done visiting with me, he was checking on how Madison and Dylan were doing.
This is a very stressful time. It's stressful for the parents because this is out of their control. Most parents go into having a family and having a baby and getting very excited about the pregnancy with the idea that they're going to have a baby at the end of that pregnancy that's going to go home with them in a couple days. Here we see that these babies do stay with us. Some are born very, very small and they're here for months. And during that time, in order to help the baby, we have technology, we have specialized doctors, we have specialized nurses, we have a very special team. But we also have to have the parents. We have to help them get through this very stressful period of time in their life.
When the babies were born, I didn't have a clue on what my role was as a father other than to just sit and watch and pray.
Miller Children's Hospital Long Beach has a Level 3 neonatal intensive care unit, which is the highest designation in the state of California. We care for the most critically ill newborns and extremely premature babies. This unit is very unique. Everybody who works here is here because of their love and passion for taking care of critically ill babies. So everyone comes to work here with the idea that what they're going to do that day is going to make a baby better.
We want everybody to know that our moms and our babies are treated with respect and love, and our dedication as physicians and nurses is to the mother-baby experience because we firmly believe that this is very important in terms of how the nurturing and nature interaction between mother and baby results in a positive growth experience for all.
The babies, Madison and Dylan, were going to be strong, healthy, beautiful, smart 5-year-olds. And that's what they are now.